You, you lost. All right, we just wait one more minute and then we will start, yeah? Maybe you could come, yeah, a little bit front. Okay. Yeah, I know. But so we are on now. Mic is on, yeah? Okay. If he's not coming in a few seconds, because of the time, I think there was. So, good afternoon, everyone. Very cozy audience. I like that. So, thank you for joining. My name is Zahed Islam. I work with the Alliance for Public Health as a director for treatment and procurement in Alliance. We're based in Ukraine. Uh, so Alliance for Public Health has a partnership together with Frontline AIDS. And within our partnership, we have about 40 partners from different countries. So within this partnership, we work on integration, we work on different tuberculosis, and so we bring in together actually experience of many different countries. So you will hear presentation today from Ukraine, Cambodia, then we have of course, Frontline AIDS, and then India. So we will have a mixed experience to share how we engage, especially on the UNHLM. So because, having different people working in different, not every country has the same approach to engaging with the community, civil society, as well as with their government. So the idea is to kind of share our experience, how we actually interacted with our country level community preparation, as well as in the UNHLM itself. So I'm a chair, but as well as I will be presenting the first presentation very briefly. I have a presentation, so I will start. So, well, no political conflict of interest. Have a seat. I will wait. Yes, I know. Okay, thank you. So now, yeah, so now we can start. So basically, I think I don't have to do this slide again because this podium had many of these UNHLM sessions, so everybody is aware of UNHLM, what is the UN General Assembly, and what was the meeting and everything. So I will just move on. There's very few slides. It's just for our kind of discussion purpose. These are three different UNHLM declarations which you could actually find it. So this morning, we had this session on health system strengthening, where we were discussing, we see many declaration happen, many resolution happens at the UN, but they don't get translated properly in the country for implementation purpose. So for example, last UNHLM, TB UNHLM, it was approved, resolution was approved, but how much did we achieve out of those resolutions, And all these resolutions also part of SDG, and then you have universal health coverage. But are we achieving those targets? Basically, that's major issue. So in terms of engagement, what we did, we work in a country where we have lots of NGOs are very active. So we work with the government, we work with the TB people, we work with broader community, and also we have regional organizations which are like TB Europe coalition. So we kind of collaborate with multiple partners in order to, get feedback from stakeholders and partners to formulate the messages. So especially this year, I think we have also a Stop TB partnership in Ukraine. So together, it was a, sort of a team effort, if you will, in a country level. So to formulate the message at the beginning. And also National Coordination Council, CCM. I mean, everybody knows CCM is very easy. So coordinated that message together with everyone before going to UNHLM. So it's a consultation, it's a preparation of documentation, and also finally trying to input information which we receive from community in a statement of the Ministries of Health, whoever is going to make that a statement. So that was kind of effort that we made together with the community. And so in terms of declaration, when we talk about multisectoral engagement, multisectoral accountability engagement means it calls for transparency as well as accountability. But I think it is very difficult in a context where you do not have, communities do not have access to sit in that level asking for accountability and transparency. And so we kind of, in Ukraine, it is perhaps is easier for us because some of our organization and alliance as an organization, we are part of Global Fund principal recipient. So by that, you have some kind of leverage maybe to go talk to the ministry and talk to the government sitting in the CCM. Yeah, so I will have to move faster. So important is collaboration and partnership is very important in this endeavor. And the challenge-wise limitation of engaging with civil society and communities, accountability process, political resistance is, and insufficient political will can be a challenge. Sometimes the government doesn't want to engage. And lack of clear understanding of this political declaration also hampers to implement. If they don't understand what is this declaration is talking about, it's very difficult to, implement them. And also, making information available is key so that everybody can have this clear implementation. So, thank you. I think this is my last slide. So it's very quick, yeah. Sorry. Go ahead. Dr. Chamroon. Chamroon is executive director of the organization called Kana, based in Cambodia. Chamroon.
Thank you so much, Sahid. Once again, good afternoon to everyone. My name is Chimran from Kana. I would like to share, but before my presentation to be shared, I just would like to say I have no conflict of interest. And in this session, I just want to share around the experience from our organization concerning to how a community partnership can contribute to NTB in Cambodia. So this is just only some background. Kana is just one of the community-based organizations in Cambodia, and under the coordination of the NTP and with support from the Stop TB Partnership, USAID, and WHO, we first introduced Mass TB to stakeholders in 2019 in order to build a strong multi-partnership to NTB. And this is the first session, first collaboration that we made to bind people to discuss about how each sector can contribute in ending TB. And that is involve several ministries that we never had before in TB response, which is beyond health. They even actually organized following the UN high-level meeting on TB in 2018 in New York, in which some of the political declaration was able to share among these people who are different stakeholders from different understanding in TB response. But actually they do have some mandate to do that in their each portfolio that they are responsible. The way that we do, we have, like I mentioned earlier, we have the engage of the different government officials from MOH at the higher level, Ministry of Interior, Ministry of Information, Ministry of Social Affairs and Vocational and Veteran and Youth Rehabilitation, Minister of CAL, Ministry of CAL and Religion, Ministry of Women Affairs, Ministry of Labor and Vocational Training, General Department of Prison, and importantly, Ministry of Economic and Finance. So these are the people that we have engaged into the discussion. And in addition to that, we all involve NGO because, TB seems to be very fragmented. So the way that we do it, we try to bring all NGO that working in other issue like HIV, comorbidity to come on board. We also bring celebrity, we also bring reporter, journalists, and importantly, we mobilize people affected by TB to join the discussion. During the event, we were able to make participants understand what are the political declarations that signed off by the member state with a clear target. And the participants acknowledge that this kind of collaboration is very important. This kind of partnership is really important to make sure that Cambodia can achieve the UN high-level meeting target. And participants also acknowledge the importance of having Stop TB Partnership Cambodia, in which right now this platform is under the host of CANA, and we have a secretariat with a clear TOR of the partnership and the TOR of the secretariat. So this is just some example of the result of how we do it. After that, there are several meetings follow up and conduct, and finally, the TOR of the Stop TB Partnership Council was finally adopted. TOR of the Secretariat was also adopted. And through this building several events and initiatives, we able to achieve a roundtable talk show and other, including the host of the event that we host the country dialogue on 3HLM, which include PPR, UHC, TB. We support to celebrate the World TB Day even in 2023, and we convene the National Dialogue on Maswat TB. And in that picture, you can see we have people from the very high level, from the Ministry of Health. I could not do that. We have the people from the Parliament, especially Senator, and this kind of collaboration never happened before, never happened for TB. But we have the lady in the middle is the chair of the commission age. Yep.
Time is over.
Yep. So that's all what I have.
Okay.
Thank you.
Thank you. Can you sort of next, Olan? No, Olga. Sorry, Olga. Olga is Olga Swili. She works with Alliance for Public Health and also manages the project of a Stop TB Partnership from Ukraine. Olga.
Hello, colleagues. My name is Olga Svili, as Zahed already told, and it's a big pleasure for me to be here in this great event and to see so many known and unknown but very inspired faces, because it's really great to see each other and to keep in touch later after such events. And of course, I want to say that I don't want to declare any conflict of interest, and I want to tell you about the Ukrainian experience about how civil society can be this driving force in preparing countries for UNHLM, because it's quite a high-level event, but we also have influence and can have influence for this process. And now I hope our experience will be useful for you. Why? What give us the right to think that we, civil society, TB community, is this force which can change something and is driving force? And what is our experience which could be useful for other countries? At first, we it's mean civil society and TB community, we were the first in the country who started to push the TB UNHLM 2023 issues among the stakeholders. We sent letters to Ministry of Health or Foreign Issues, to our UN mission, to President, to everybody we could. We had meetings with some of them, unfortunately not with President, but let's leave it for the next UNHLM. I hope we'll manage. Civil society and TB community representatives took part in a multi-stakeholder hearing on TB in May 2023, and it was really great opportunity to establish strong collaboration with our UN mission. And thanks to this, it gave us the ability to get information about UNHLM from the first hand. And we had opportunities to make recommendations to each draft declaration before and during the debates. Of course, we did it together with NTP. At each stage, we had immediate cooperation with NTP in finding the optimal formulations in the text of the declaration, and the result of its joint joint document from the country. Joint, I mean NTP, Ministry of Health, plus TB community and civil society. And an example of influence of the one country civil society to such high-level process could be the easy calculation. Out of about 55 amendments proposed by civil societies and TB communities representatives, to the first draft of declaration, 23 we can find in the final text of declaration. It's verbatim, or essentially they are there. And I think it's not too bad. It's only a civil society, TB community. It's only one country, but we have a lot of countries, and we have a lot of great people in civil societies, civil communities in each country, and it can be, and we're sure that you also were engaged in this process, and maybe our amendments also became possible because of your engagement and similar proposals in your countries and at your stages. Also, according to the decision of our NCC, we had a great collaboration with NCC Secretariat, really great work with them, and Stop TB Partnership Ukraine, Zahet already mentioned this organization, became responsible for to choose the delegates from civil society and TB community. And the open competition was conducted, and we have two representatives, one from TV community, another from civil society, who became members of official national delegation. And they went to New York, and you can see these great, nice photos and how this Unichi lamp was seen by eyes of our Ukrainian representatives, not only from civil society, but from all our joint friendly team.
Thank you very much, Olga. So now I invite Olan McFadden, Frontline Aids, for your engagement in pandemic preparedness and everything.
Yep.
Go
Right.
ahead.
Hello, everyone. Thank you very much. I'm going to try the clicker now and see if it works. Click. Nope. Oh, there we go. Perfect. Love a good clicker. Right. So as the heads mentioned, building on what some of the other speakers have been talking about, I'm going to... Am I going in the wrong direction? Yes, I'm going in the wrong direction. Yeah. There we go. Next one. Click. Let me try it, yeah. Might be easier, yeah. Yeah. Okay, okay. Maybe not. Nope, nope, sorry, sorry. Oh, right, okay. I thought it was like a PPPR slide, okay. Ah, perfect, okay, thank you. Sorry, technical difficulties, here we go. So yeah, I was going to build a little bit on what the other speakers have said and talk around the role of the TB response in future pandemic prevention, preparedness and response efforts, and really building on what works in the TB movement. Many of you will probably know this already, but just to give a little bit of a background, what is PPPR, which is Pandemic Prevention, Preparedness and Response? This really refers to the efforts to strengthen national, regional, and also global capacities and resilience for future pandemics that may or will likely occur. And really, we've seen that in the wake of how catastrophic the impacts of COVID-19 were, there's been really renewed focus and prioritization on strengthening PPPR and making sure that when the next pandemic happens, the countries, local communities, globally, we're all better prepared to deal with the impacts of that. And we've seen, I think, particularly within the HIV response and also within the TB response, that COVID was particularly catastrophic for many of the most marginalized and most vulnerable communities that we work with, and has really exacerbated the lack of equity that we often see between countries and also within countries. So some of the main global level pandemic preparedness initiatives that have been launched post-COVID include the negotiations around a proposed pandemic accord that's been hosted at the WHO. There's also an ongoing review of the international health regulations to make those stronger, better prepared for pandemics. A pandemic fund has been launched at the World Bank. And then also there was the high-level political declaration on PPPR, which was launched at the same time as the TB-HLM declaration. So really, what is the role of the TB response in all of this? Well, I think really to recap maybe quickly before that, the key role that the TB response played during COVID-19 over the last several years. There was many overlapping characteristics between COVID and TB, both been primarily transmitted via respiratory tract secretions. There's also this same marginalized vulnerable communities were at a higher risk of infection for both. And there were many overlapping systems of pathogens, pathogen surveillance and treatment that they had in common. So because of these overlapping links, the TB infrastructure and response practices, which have been built up over the past several decades, were often redirected to respond to COVID-19 in terms of the diagnostics, treatment centers, and then infection prevention protocols, as well as human resources. Now, unfortunately, because these systems which have been developed were so successful and so useful in terms of responding to COVID, that meant that them being rediverted in that direction meant the TB response faced really disproportionate setbacks and challenges, because all of these resources were repurposed. And we really saw post-COVID-19, for the first time in a decade, there was an increase in the rise of fatalities related to TB, which is really alarming and concerning. So that was the sort of reality of TB for COVID-19. So if we're looking at TB in future pandemics, what is the role that TB and the TB response needs to play for these? I mean, we know that there's a high possibility that a future pandemic X, so to speak, that emerges is also going to be an airborne infectious disease similar to COVID and TB. And based on experience during the COVID-19 pandemic, it's therefore very likely that the infrastructure and systems within the TB response are again going to be a key tool against this future pandemic X. And based on this, it's clear that the TB response should receive support and investments, not just as a priority for TB itself, but as a priority to prepare for future pandemics, since many of these systems and responses are probably going to be a key part of preparing for that. I think in particular, and similar to what we've seen in the HIV response, there's the distinct capacity within the TB response to engage and reach vulnerable, marginalized communities in terms of testing, treatment adherence, disease surveillance, contact tracing, and many other areas. And this will be a key tool when those communities are more likely than not going to be on the front line of any future pandemics. In terms of the current overlaps between TB and these pandemic preparedness efforts, really what we've seen, I think, is that the role and the essential key building block of the TB response for pandemic preparedness has been underutilized. Currently, there's been no reference to the TB response in the draft text for the pandemic accord, which has been negotiated at the WHO. And the high-level political declaration on PPPR, which was launched last September, was developed and processed very, very separately and distinct from the high-level political declaration on TB. They were very distinct political processes. And I think, as we've all seen as well, the TB response continues to be underfunded and underreported, despite, as we've also seen, TB is likely going to be causing more deaths in 2013 than COVID in low and middle-income countries. So it's a really concerning deprioritization. So I think moving forward, how do we ensure that the TB response is fully engaged in future PPPR efforts? We need to ensure that civil society and communities from the TB response are well represented in negotiations at the pandemic accords at the WHO. Governments need to be educated to understand that one of the best ways they can prepare for future pandemics is by supporting strong investments in the TB response. And the TB response itself should be funded as a key building block for PPPR. And that really a key indicator to record the country's capacities for pandemic preparedness needs to be their current capacity in terms of TB systems and programs to see and understand, like, will they be prepared for a future pandemic that will likely happen at some point in the coming years. So yeah, those are my main points. So thank you very much, and I'll pass back to Zahed.
Thank you, Olan. So I think there is a great insight on PPPR and how, as a community or civil society, can engage into the PPPR to ensure that TB community is represented. At the same time, also fighting for the funding within the PPPR, because there is a provision for it. So I think we may need to kind of explore that more, because communities actually have no idea how to engage in this, especially PPPR. Maybe on the UHC a little bit, but with the PPPR, I don't think there is that much knowledge around, especially within the TB community. So maybe that would something maybe people would have interest in. Thank you, Olan, again. So now I invite Amrita Sarkar. She is from Alliance India. She's a program officer working in India. Amrita.
Okay, so thank you so much. First of all, I'd like to thank Frontline AIDS and definitely APHA for giving me the space to talk about. And whatever I'm going to share today, this will be basically a community-led experience, sharing from the community. I'm a trans woman myself, and I'm going to talk on behalf of the trans community, whatever HIV-TB integration that is happening through a very big program in India. So in the beginning, definitely I have to state that I have no conflicts of interest. So my presentation is titled Integrating Transgender Persons into TB Testing and Treatment, Community-Led Advocacy for Political Change in the Context of Ending TB. Talking about Alliance India, we started in 1999. We're an extension of the Frontline AIDS, earlier known as International HIV/AIDS Alliance. Our mission is to support community action to prevent HIV infection, meet the challenge of HIV, and build healthier communities. We have 3 offices, with head office in Delhi and other 2 offices in Guwahati and Hyderabad. Earlier, we worked in harm reduction in multiple countries outside India, like Thailand, Vietnam, all those places. Currently, we work with more than 400 plus community-based organization and non-government organization in terms of providing capacity building support and other grant support, because we are one of the PR of the Global Fund in India. So this is a program I would like to share about. This is called Project Vihan. That is a care and support program led by Alliance India that we started from 2013. It's a very old and experienced program involving all the community members, all the sets of key populations, with more than 319 community support centers spread across in the country. The overall goal of the Vihan program is to improve the survival and quality of life of people living with HIV. The most important part that, according to my interest, is the transgender community support center. We have total 10 dedicated community support center for the transgender person living with HIV, and those are led with the transgender leaders, transgender-led organizations only. And on the left, you can see a picture of a book. It's called National Framework for a Gender-Responsive Approach to TB in India. This has been published by the Health Department. There also they mentioned about how to promote gender-responsive approach, not only for the male-female binary thing, but also including the transgender persons. And a couple of information I would like to share more. Yes. So you can see a couple of graph here. So if I go to the number of transgender person living with HIV that we identified under Vihan program, and those are into active care. You can see the graph from 2021, because HIV-TB integration is not a very old thing. It's a new concept, a couple of years old only in India, and you can see like around 6,000 people are currently in active care. There are a number of TB symptomatic people living with HIV who are referred to ARTC and nearest TB testing facility and tested, because in India we have a very common rule, that is if someone is coming for HIV testing, we have to refer for TB, and the vice versa. If someone is coming for TB testing, we have to refer to HIV testing as well. So under that, in 2022 to 21, you can see around 500 transgender person, and then the number slowly gone down. Then this is the number of PLHIV found TB symptomatic 4 days. You know the 4 days testing the strategy through cough, through fever, and so those are the 2, and through the ICF, the intensified case finding of World Health Organization, where we talk about that if a person is detected with HIV, definitely has to be referred to the TB testing and further treatment if needed. Then in terms of ATT, number of PLHIV, transgender PLHIV who are detected TB positive, who are initiated on ATT. So this is in a nutshell, and this is the last slide, and if I have to conclude that the main objective of my presentation was to share community-based experience, because this program is coming to an end in next year, and in India currently one-stop center and the comprehensive healthcare approach are become very popular these days. So to continue that effort, I will like to give a message to all of you. I also had a word with Global Fund, and they definitely whoever is listening to this, I will also like to say that please give importance to the community, because community-led response is absolutely important. If a transgender-led organization or any key population-led organization are into similar activities, similar TB intervention, we do need to encourage them, and we do need to give them opportunity in terms of not only implementing the project, but also, in terms of CLM, community-led monitoring, in terms of decision making, and to, take the program ahead. And last but not least, thank you all so much for listening to me. Thank you so much.
Thank you, Amrita. There was great experiences shared from all across. So I don't know if you have been able to get to Slido or questions. Since we are a small group community, we will pass over the mic, and if anyone has a question, perhaps, of course, Fasid here.
My question's actually to you, Chamroon, because great presentation, but you skipped over the lessons learned. So I'm very curious about what those lessons were.
Can I answer now?
Yes, please answer.
Yeah, one of the key lessons learned is about, when we start doing this kind of a partnership, it allows stakeholder to come on board and allow the stakeholder to acknowledge that ending TB is not just about health, but it is about how we build collaboration and support to each other. For example, Ministry of Education, they can do education, about TB for prevention. Importantly, send a message to the children, adolescents, include the message into the national curriculum, for example. And that is no cost because it's part of the education. Ministry of Social Affairs, they have to acknowledge that there are a group of people who have TB, but because of their poverty, because of the lack of food support, this put them at risk to TB, or not giving them enough time to stay into TB treatment adherence, for example. And at the same time, for the Ministry of Economic and Finance, they know the story that they only look at the data. They always want to see data. They always want to see what you call it cost efficiency. We say that based on the global plan to end TB that shared by the Stop TB Partnership, it clearly mentioned that if they invest $1 for TB, they can return $40+ dollars.
Right.
So why don't they invest this kind of thing? Why don't they want to stay? Why don't they want to keep this ancient disease continue to stay in the country? If they see this kind of return is so good for the development of Cambodia. That's what I want to say. Thank you.
Thank you very much, Chamroon. Anybody else have questions to our panel? No? Yeah, please.
Okay, good afternoon. All the presentations are very impressive. I would like to ask if there's a TB alliance in our country, in the Philippines, because I am working in a university, but I don't know if there is. So I've been working on childhood and adolescent tuberculosis in far northern Philippines. And we've been organizing as well, like Cambodia. And we have this CATB family partner, like a sort of a small foundation. And we like encourage even the children to contribute 1 peso for TB. And we've been doing that, and the health workers are as well very supportive. And we've been backing even the project sites that I had. So I don't know if TB Alliance is present in our country. Sorry to ask.
No, I don't know. There are people from TB Alliance, here in the conference, but not right here. But I think if you come to Community Connect, maybe we will find them sometime. So
Because
they have a booth also. TB Alliance have a booth, so you could actually go talk to them. That would be helpful.
yes,
But in
because
this meeting, I don't think that there is anyone.
sorry for that.
Yeah, no problem. Yeah.
Because there are good best practices, because we also have very high incidence of HIV already.
Yes.
We've been in the 90s. There were only two, I think, that's imported, but now it's
Okay.
very price, more of rising. And of course, TB is also on the rise because of the pandemic, and that's still understandable.
Yeah.
So anyway, thank you.
Thank you. Thank you. Anybody else? Okay. There is a question.
Thank you very much for the very interesting presentation. I have a question to Ms. Amrita, actually, because it's very interesting that your presentation mentioned that you also have engaged to um, in Indonesia. You have engagement in Indonesia. Personally, I'm from Indonesia, and unfortunately, in Indonesia, there are still issues regarding LGBT. Acceptance with LGBT. So my question is, in places like Indonesia, in my country, how can we actually also involve the LGBT community and in TB advocacy, considering it's currently not a legal, there are currently unfortunately no legal acceptance, we can say, about LGBT in Indonesia. Thank you.
Okay, thank you so much. Actually, I tried to mention about our past project on the harm reduction. There we worked in Indonesia and other countries. But I would like to request you, once we are back from the conference, we can exchange our contact, because I have some contact in Indonesia, and I think I'm also, known to the people at AFCOM, APTN, and all other places. So definitely we will, explore how LGBT community help, because I am aware of that LGBT people are getting discriminated not only in Indonesia but in other countries like Pakistan, Sri Lanka, and all other places. So definitely it will be a great opportunity if we can get in touch after this conference and how to take it forward. Yeah, thank you.
Thank you. I have one question to Olan. So since there are very little knowledge within our community onto engagement with the PPPR, can you kind of give a very brief sort of guidance on how the community can be actually get on board, especially from the TB community, sort of joining the bandwagon, if you will, with the PPPR?
Yeah, I think one way which would be very good is currently with the pandemic accord being negotiated at WHO, there are a number of different civil society groups engaging in those negotiations. So you'll hear somebody speak from a perspective of the HIV response or of One Health or Animal Health. There's civil society groups there representing older people, other communities. From what I've seen, there doesn't seem to be as much engagement from TB coalitions or TB networks within the pandemic accord negotiations. And I think if there is a way for one of the global level coalitions or one of the regional coalitions to put themselves forward to take part in those discussions and to put forward the perspective of the TB community in that discussion, I think it would be very important, because if, as is expected, in May 2024, this pandemic treaty, this pandemic accord is signed and approved at the WHO, it will guide a lot of the national level country work around pandemic preparedness going forwards. So I think between now and May 2024, it would be very important and crucial to have the perspective and the experiences, learnings from the TB response within those negotiations as much as possible.
Great, thank you. I think that would be really, we look forward to maybe some of the TB community maybe get in touch, and if anyone wants to get in touch with Olan, do let us know. We will get you in touch with him. Just before, maybe we are almost running out of time, so is there any other question from the floor? No. So I think, I would like to say thank you to all the speakers and for giving different perspective on the UNHLM engagement, preparation, as well as, what are the key issues that when we come back home with the UNHLM resolution. It is not the resolution itself, but I think how we act on those resolutions and how we make our government accountable and, in a transparent process. I think so this is more important as a community for us to take home. So thank you everyone for joining and listening to our talk, and thank you, panel.